Healthcare is becoming increasingly more complex, and public health and healthcare fields are striving to better reflect and serve the nation's diverse communities. A dedication to public health increases community engagement, workforce development, and research initiatives with a focus on eliminating health disparities. Responding to these unique needs, on November 2022, my alma mater, George Mason University in Virginia, launched the first and only College of Public Health in the Commonwealth to meet the critical growing needs for skilled interdisciplinary health professionals and research across the state. What is the mission and goal of the college? How will it make an impact in the diverse communities of Virginia? And what does the future hold for public health in the Commonwealth? Welcome to another episode of the Collective Voice of Health IT, a WEDI podcast. I'm Michael McNutt, WEDI's Director of Education and Events. For nearly 30 years, WEDI has been an instrumental force in igniting public-private partnerships to empower meaningful change for the American healthcare system. Recognized and trusted as a formal advisor to the Secretary of Health and Human Services, WEDI is the leading authority on the use of health IT to effectively improve health information exchange, enhance care quality, and reduce costs. With a focus on advancing standards for electronic administrative transactions and promoting data privacy and security, WEDI has been instrumental in aligning the industry in an effort to harmonize administrative and clinical data. Learn more about WEDI on our website, wedi.org. Today, I'm proud and excited to welcome Dr. Melissa Perry, Dean of the College of Public Health at George Mason University. Trained as an epidemiologist in public health, she is internationally respected for her work as a scientist, educator, and academic leader. Dr. Perry's research in occupational and environmental epidemiology has been well-funded by both federal agencies and foundations. Prior to coming to Mason, Dr. Perry has served as faculty and department leader at the Milken School of Public Health at George Washington University, Harvard School of Public Health, and the Medical College of Wisconsin. Dr. Perry, welcome to the Collective Voice of Health IT.
Hey, Michael, thanks so much for having me.
My pleasure. First, before we go into all the talk about the college, which I'm sure you're proud of and I'm proud of as a gold, green, gold, gold, fight, 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 George Mason patriot, let's talk a little bit about you. What were your kind of motivations, aspirations, and inspirations to get into healthcare?
Absolutely. No, I'm delighted to be here. You know what? I'm a rural person at heart. I grew up in a rural area of northern Vermont. And so when I was a teenager and really starting out, going to college, I came from unlikely beginnings. In fact, I went to the University of Vermont completely as a Pell eligible student. That meant that I had full federal support in order to go to college. So I knew early on that education was critically important, and I was really affected by the number of different health problems, mental, psychological, social problems that were happening in my rural community. As I got more of an education, I was majoring in psychology, I encountered this amazing professor, and he taught me this lesson that I've shared with all of my students. And he explained that no mass disorder afflicting humankind has ever been brought under control or eliminated by attempts at treating the individual. And this was a very profound lesson for me that led me on my path into public health and epidemiology, and really has been a source of guidance as I've traversed various academic environments, worked in various communities with a variety of different partners, stakeholders, and population settings. And here I am now at the College of Public Health at George Mason.
Fantastic. And I'm sure they appreciate your presence there greatly.
I'm enjoying it a lot.
Oh, perfect. Excellent. Walk us through the College of Public Health. That was created at Mason not too long ago, November of last year. What were the underlying items that prompted its creation?
Absolutely. It actually goes back sometime in history, almost 9 years ago, in fact, that there are a number of leaders and faculty and students, for that matter, that understood how this college, which was previously the College of Health and Human Services, could have such a vast impact in an interprofessional way. And what I mean by that is bringing together healthcare. We have a School of Nursing within the college. We also have a Department of Social Work. And then we have the more standard areas of research and teaching, including in epidemiology in nutrition, in health services, health administration. These are all areas, and community health. These are all areas that have come together under one umbrella to really deliver to the region, to the Commonwealth and beyond, the power of population health, of public health, of prevention mindset when it comes to health and healthcare.
That's fantastic because if I'm understanding, maybe all the different departments were kind of working in silos, but then this college kind of brings them all together.
In many ways, I would say that they were all assembled under one roof, but not necessarily interconnected. And so with this vision, with this focus on population health, nursing has been on the forefront of public health and preventive health for forever, since the inception of the discipline. And so they have been public health leaders, as well as in the field of social work. Imagine that really embodies the discipline of social work, is to how do we prevent psychological, mental, and societal distress. So there was no better way to really deliver on the power of, again, a public health and a population health mindset than to bring these various units all together within the rubric of a college.
Fantastic. The idea of bringing everyone together, fueling and kind of pulling everyone's resources for the greater good is really a great story, and something that, oftentimes in healthcare, we're often kind of accused of living in these unique silos instead of kind of working together. By working together, we uncover a whole lot. So that's one of the great things about Wheaties. We are a multi-stakeholder organization with providers and payers and vendors all working for the common good. So I love to see that it's also representative at the college level. I read that the college has over 500 partners covering many elements of healthcare. In addition, you're quite fortunate being so close to Washington, D.C. and Capitol Hill in order to take advantage of connecting with legislators on public health issues. Give the audience some prime examples of how the college is working to make a difference in the health of Virginians.
Absolutely. You're absolutely right. It's a very vibrant, it's a very dynamic milieu to be operating in. That was a big reason why I was so attracted to this position. I knew that in this role, this would likely be the place that I was going to have the most impact on the most number of students, and ultimately be able to reflect and reverberate to the broader region as well as the Commonwealth and beyond. A big area that we're focusing on front and center is around inclusive excellence. We're super proud of how diverse and how inclusive our university is and our college is. For example, about 38% of our students are eligible for federal financial aid. About 33% are first-generation college students, and about 18% are both first-generation and Pell eligible. Can you imagine the kind of impact that we're having on really changing people's lives, opening up that opportunity for education for the first time in a family, in a generation, that people would come? And really the message is, if you want a first-class education in health, in healthcare, in nursing, in social work, in nutrition, in epidemiology, in health services, in health informatics, this is where you can get it. We want you here, and we're going to deliver on the promise of excellence in education. Another big area of emphasis is in mental and behavioral health. And I mentioned our Department of Social Work. That department collaborates across the college to really focus on some critical, urgent issues as we've been seeing as a society. As I mentioned, one of my areas that really sparked my interest early on in my late teens, early 20s was the prevention of mental disorders. And so this cross-college collaboration means that our students are not only learning how to identify and to diagnose mental health conditions, but we're thinking about the factors that increase the risk for mental and emotional problems, and how do we reduce them through a variety of various interventions and also partnerships. And then finally, I wanted to mention the space that we're operating in research and innovation. So briefly, we've really been going front and center on virtual reality. And I have to admit, I'm not in the curve of technology adoption. I wouldn't say I'm an early adopter. Sometimes I'm a late adopter. But when it comes to virtual reality for the current and future of innovative education, I'm super excited, and I can tell you more about that.
Oh, no, very much excited because we've actually had Dr. Farouk Alemi from the college participate in our how artificial intelligence will improve the patient engagement. That can be found on our YouTube page, Work Group for Electronic Data Interchange. But yeah, would love to hear. I understand the pillars really around the college, teaching and learning. You've already mentioned how not only are you teaching, but they get a greater understanding of the mental and behavioral health, research and innovation. You talked about virtual reality. I'm sure telehealth is in there somewhere as well. Workforce development and community outreach. So feel free to kind of offer a little more background on these pillars and just how you're building this fantastic kind of infrastructure of knowledge at George Mason.
Absolutely. The community outreach, again, is at the center of our commitment, our dedication, and our mission. We have a series of free care clinics, the Mason and Partners Network clinics. Talk about a demonstration of really what we truly value as it relates to access to healthcare for everyone, equitable access to healthcare for everyone. That's really what embodies public health. And so these free care clinics are available throughout our region within about 8 or 9 different clinics that we have. And it's really intended for the folks that just do not have other options. We're there. Our practitioners are there, and our students are in constant opportunity to learn and to provide care to a variety of different patients that are dealing with all sorts of health issues, everywhere from simple preventive care to diagnosis of infectious diseases to we've been specializing also in tick-borne diseases. There's a variety of different health issues that we focus on through our free care clinics. I wanted to also mention about some of the remarkable stories of our students.
Yes, please do.
For example, I'll just tell you one. There are so many success stories, and we're just getting ready to graduate over 800 students this Saturday. And again, in so many ways, their lives have been transformed, but they also transform our college and what they bring, what they show up with, what their stories are, and what their vision for the future is. Arian M. Lillard Green, she's a health services research doctoral student. She was named an Academy Health Diversity Scholar, which is a program to support and develop underrepresented racial ethnic minorities in the field of health services research. She's a former clinician and hospital chaplain, and she wants to shape health policy for equitable end-of-life care, for equitable hospice care. She's just one example of the hundreds of stories that we have, even among our current graduates, as they go forward to be employed in a variety of health positions, both again in our region and beyond. So we're really focusing on community partnerships as well as excellence in education and the relevance of their training so that they bring those skills to their employers, so that we really see innovation and delivery of high quality care and equitable, easy access to healthcare to ultimately enhance population health across the board.
That is fantastic. And I love hearing the success stories. And really, yes, we can talk about the pillars and we can talk about all these things, but really the success of a college is truly the students that come out and really make a difference out there. We're talking with Dr. Melissa Perry, Dean of the College of Public Health at George Mason University this week on the Collective Voice of Health IT. It's been fantastic chatting with you, Dr. Perry, and I know you're crazy busy getting ready for graduation. I didn't realize it was Saturday. How can people learn more about the college and about all the fantastic work you and your students are doing?
Well, I want you to check out our website for sure, the College of Public Health website. We're doing all that we can to communicate outwardly and also to host a variety of different forums and places where we converse on what are the critical issues for healthcare in the region. We really are seeking to be thought leaders in that space. During National Public Health Week, for example, we convened a fantastic panel to really dive in front and center on gun violence and gun violence as being a leading cause of death. We had a number of different activities during National Public Health Week. We're going to continue to do that. I did want to just mention the virtual reality and also the AI space.
Yes.
So as I mentioned, have never been the first to adopt technology, but once I came to understand that in some ways the virtual reality immersive learning space could well be the only space that you could train in this kind of innovative way, rather than tabletop exercises, role playing, or scenario planning, I was sold. And so we have rich VR material and curricula for our School of Nursing students, but we also are developing it in these other areas, including in social work, in health management for that matter. We talk a lot about systematic racism, implicit bias, microaggressions. Well, how do you work through those kinds of scenarios? You do it with some rich curriculum and immersive VR experiences that better train our leaders to encounter, to understand, and to be able to dialogue and to message around these issues. So the vision is we're focused on raising about $20 million in the next 2 years to invest in VR. So it's a major fundraising goal. And the vision is to deliver VR education for all of our learners across the college. And we really believe that we can do it.
Awesome. Best of luck. It has to be somewhat of a shock to the system. You know, you talked about your background and being from rural Vermont, and now we're sitting here talking about virtual reality and AI and Chat GPT and everything that Dr. Lemmy was talking about on our video. It has to just amaze you, the evolution of technology and how it can help, produce improved proper healthcare results.
Absolutely. You nailed it. Most definitely, Michael. I couldn't agree more. At the same time, there's still a part of me that can dial back to that rural person coming from Northern Vermont. In fact, when I first stepped foot on the university campus in Burlington, Vermont, I was overwhelmed as though it was a major metropolis. So I can fully relate, again, with so many first-generation college students coming to our college. I can relate to what that's like. And I can also relate to how exciting and how enticing it is to be in an immersive learning environment where you're discovering, actually, I can do this. And not only can I do it, but I'm really enjoying it. And not only am I enjoying it, but I can see the future and what this means for my life and my dedication and my commitments in the world.
No, that's fantastic. Dr. Melissa Perry, Dean of the College of Public Health at George Mason University in Fairfax, Virginia. Once again, thank you for being a wonderful guest. I look forward to the possibility of working with the school, the college, and your students at George Mason quite soon.
Michael, I appreciate you and I appreciate all that you do. And thanks so much for having me as a guest today.
Definitely my pleasure. This has been the Collective Voice of Health IT, a WEDI podcast, where the healthcare IT communities connect, collaborate, and create solutions for a better health system. Find all our episodes as well as information on our association on our website, wedi.org. Thank you for joining us, and be safe.